The question is the amendments be agreed to, and give the call to the member for Warringah.
Thank you, Mr Speaker. I unfortunately must strongly disagree with the Minister that these amendments do not, in effect, change the importance and the strength of the original bill, which I voted in support for, and commended the government for taking such a strong stance on such a scourge that is impacting young people, leading them to be addicted and hooked on smoking or a similar nicotine, which leads them to smoking. We know vaping is a strategy of big tobacco, and I absolutely welcomed the government's willingness to ban it and to make it incredibly hard to obtain, and in particular that it could only be done through prescription to ensure that it was very much limited in how people over 18 could access it. Unfortunately, the effect of the Greens and the crossbench in the Senate's amendments dilute a lot the effect of this legislation. My understanding is that we now have a situation where people under 18 or all will be able to have 9 items on them per person, but there is no limit on a per day or situation. So you essentially can still have a situation of a lot of items on people's person, and there will be no consequence for that, and that can be repeated day after day. In a situation where the minister says we have 1 in 6 high school children vaping, what does that mean if they can each day have 9 on their person? That is still a system where you are going to see the on-sale of vapes and a black market of vapes. You are allowing too many vapes to be in the hands of children and adults. And so I would ask the minister, what measures are you going to put in place to reassure parents that they are not still going to see vapes everywhere in the schools? I would ask the Greens Party, who have asked for these amendments and pushed for this to happen, how are you going to ensure to parents that we are not going to see this masses still having vapes for our children, impacting them in their schools? And in relation to now the situation where we are going to see essentially pharmacies take on a role of tobacconist. So those horrendous shops that we've seen pop up all around our communities, as close to schools as they possibly can, in areas to appeal to children and young people, young adults, we now have a situation where pharmacies are going to be asked to sell behind the counter a product that we know from a health perspective is dangerous. It has a negative impact on people's health. I cannot see how this is a positive development for the government to have caved into these amendments. I strongly support the bill as it originally stands, and I am incredibly disappointed with the crossbench in the Senate, and in particular the Greens Party, for having pushed for these amendments rather than support a strong ban that genuinely put the health of children and young people and adults at the heart of the legislation. So I do ask the minister, since this is the process for it, what protections and additional measures is the government considering to ensure we don't see that kind of on-sale of vapes between children, a black market emerging, and what measures will be put in place to ensure, with this sale from behind the counter from pharmacies, that there is actually the smoking cessation aspect, but also the cessation of vaping. What measures will be put in place to ensure people are not addicted to vaping and actually reduce their reliance on vaping?
The question is the amendments be agreed to. Give the call to the member for McKellar.
Thank you, Speaker. Firstly, I'd like to thank the government and commend them for the work that they have done to eradicate vaping in the way that they can. There's been so much hard work that has been done behind the scenes from public health agencies and health promotion agencies. Vaping, single-use vapes, was an absolute scourge, is an absolute scourge, I should say, and one that targeted our children in a way that was extremely cynical. So much so that schools in my electorate have had to install vape detectors in bathrooms because children were leaving classrooms to go and vape. And the impact that has had on children's behaviour and concentration, their ability to learn in school, has been absolutely horrific. What I would like to say, however, is I am disappointed at the watering down of what was a really incredible bill. I am disappointed. It is sad because it was a once, I guess, in a generation opportunity to really end the scourge of vapes and the targeting of our children with that. My concern is that the ability for vapes to be bought from without a prescription for people over the age of 18, the ability to buy over 9 will mean that people will go from pharmacy to pharmacy to pharmacy. Just as people doctor shop to get certain prescription medications, they will be shopping around their pharmacists. They will be able to get a large amount and they'll be able to on-sell those to their friends. Their 18-year-old friends, they'll be able to sell to the children who are already addicted to nicotine. We know that nicotine is one of the most addictive substances known to mankind. A large majority of children are already addicted to nicotine. When it becomes expensive, having to buy those those vapes, I should say, they will simply turn to smoking, to cigarettes. And so it is a gateway. It leaves the door open for vaping to continue, and it leaves the door open for that move towards cigarettes. So it is a cynical ploy by the big tobacco companies who want to start manufacturing these vapes. It is a cynical ploy to continue to get people hooked on nicotine, which is a gateway to smoking. So although I really support the measures that the government is trying to implement, I'm very disappointed that it's been watered down in this way, because I think it will only leave the door open to more smoking in our young people. Thank you.
The question is the amendments be agreed to. Give the call member for Kooyong.
Thank you, Mr Speaker. And I also rise to express disappointment at the watering down of this incredibly important legislation. And members of the crossbench in this House were very much supportive of the government in bringing on what was really courageous innovation. It's really unfortunate that it's been necessary for the government to make these concessions in the Senate. I'd like to make the point that one of the reasons why that has been necessary is that Senators Lambie and Tyrrell in the Senate have consistently expressed real concerns about the fact that Medicare services in this country are not sufficient to provide the support that people who want to give up smoking need. For GPs to be able to provide that sort of service, they need to have time, they need to have the relevant training, and they need to be able to give people wanting to get off cigarettes the support that they need. It's not a simple process. It's not as simple as just writing a script for vapes. What we know is that people can't access GP services in many parts of this country. And when they do, many people are forced to deal with an out-of-pocket fee that they simply cannot afford. And so the need to water down this legislation in the way that we've seen in recent weeks reflects a failure of our Medicare services, which is heartbreaking to see, because all of us in this place, I think, agree that smoking is a bad thing and that vapes is a bad thing. Almost all of us. I'll come to the Nationals in a moment. So it's incredibly disappointing that we are seeing this problem with Medicare and its deficiencies, and as a result of that, the need to water down this legislation. I'd also make the point that what we are seeing at the moment is many Australians resorting to online providers of prescriptions who are, in many cases, therefore, also going on to provide vapes to people who are looking to smoking cessation. And I think that this is a failure of our regulatory system at the moment, which also warrants review by the Minister. We're not providing best practice care when people can go online and get a prescription for vapes which are sent out essentially by the script provider. That is not a situation where people are receiving best practice care for smoking cessation. Finally, I would like to address some concerns that many Australians have about the fact that one of the major political parties in this country continues to receive significant donations from the tobacco lobby, which is the same as the vaping lobby. And I would call out the National political party, which is a very bad tail wagging, essentially, the Liberal Party in its decision to oppose this legislation, which has forced the government to deal with the crossbench in the Senate as it has. It's an absolute disgrace when a major political party in this country continues to receive donations from the tobacco and vaping lobby. And I think that Australians should continue to consider that and should always take it into account every time that they think about the National Party and whether or not it is reflecting the best interests of them and of their children. I'm sorry that I can't support these amendments in this House. I'd love to. I'm very happy to see the vaping legislation go forward, but it's very, very disappointing that it's had to be watered down in the way that it has.
The question is the amendments be agreed to and give the call to the member for Indi.
Thank you, Speaker. And I rise to back in the arguments put forward by my crossbench colleagues on these amendments. I too congratulate the government on the hard work that they undertook to get these vaping laws to the point that they did when they went to the Senate. I have been loud and encouraging in my support of the government's actions on stamping out the scourge of vaping for our young people. We are also aware, incredibly aware, our professional bodies and the Australian Public Health Association, Vic Health, so many other professional associations applauding the government on difficult work in stamping out another gateway pathway to addict our young people into an unhealthy habit which has profound impacts on their further life. It beggars belief, really, in politics that we can do such good work and that it comes down to the decisions of a small few in the Senate, ultimately, who have the power to change the course of history in a way that has such long-term impacts on our nation. So I am very disappointed. I didn't expect, really, to be in a position where I would be voting against something in the House today when it came to vapes. I'm very disappointed in the argument that was put by the Greens in the Senate. And I also want to commend the member for Kooyong in calling out the National Party in accepting political donations from Big Tobacco. While we have political donations laws in this country that enable this to happen, and when we have a lack of ethics from a major party to accept political donations which can influence policy in such a way, then we have a real problem in this country. We have a real problem when it affects the long-term health of our kids. So I thank the member for Kooyong for pointing that out. I do say to the government this is deeply disappointing that you have had to compromise in this way. And I also want to acknowledge the concerns of our pharmacists across the nation. We've talked more about pharmacies in this term of parliament than we have probably in any other time that I've been a member of parliament. And I can understand why they are very angry about this and why they are asking questions about why they weren't consulted and why they are now shouldering responsibilities when it comes to the dispensing. It's not dispensing, of course, it's the sale of vapes. So I think that is deeply problematic, and I will be voting against these amendments in the House today, and I'm disappointed to be in such a position where I will do that, and I want to put on the record that I voted strongly in favour of the original law that was put to us in the House of Representatives. Thank you, Mr Speaker.
The question is the amendments be agreed to. The call to the member for Ryan.
Make some points of clarification here. The Greens have negotiated amendments to the Therapeutic Goods and Other Legislation Amendment, Vaping Reforms Bill, and will support the legislation's passage through the Senate, as we have. As a result of the Greens' negotiations, we've secured significant changes to the government's prescription-only legislation that risked criminalising, and this is a really important point, people for possessing vapes for personal use. And the changes include: 1, vapes will be available from a chemist as a Schedule 3 pharmacist-only medication for adults over 18 years old, rather than requiring a prescription from a GP. These will be plain packaged and properly regulated vapes. Data of vape purchases will not, and this was critical for us, will not be recorded. GPs can continue to prescribe therapeutic vapes, and a prescription will be the only pathway for vapes for people under 18 if they're deemed clinically appropriate. 3, possession of personal use quantities of any form of vape will not be subject to criminal charges. This was a particularly important point for us. There'll be an 8-month personal possession amnesty period. Commercial quantities sold by retailers other than pharmacies will be unlawful. 4, as this is world-leading legislation, there'll be a review of this legislation after 3 years, another critical point. There'll be an expanded disposal framework via pharmacies. There'll be stronger regulations around advertising to healthcare professionals. Additional funding will be announced to support young people quitting vaping. Thank you, Speaker.
The question is the amendments be agreed to, and give the call to the member for McKellar.
Thank you, Speaker. I support the Greens' amendment to decriminalise the possession of vapes, small amounts of vapes. One thing that I did want to say, though, was just picking up on the fact that no data will be collected from people purchasing vapes. That opens the door, as I said previously, for pharmacy shopping, to buy an amount from one pharmacy, 9, an amount from another pharmacy, another 9, and continue on like that. There does need to be data collected on people who are purchasing vapes, because otherwise that will open the door to on-selling of vapes in the future to young people.
The question is the amendments be agreed to, and I give the call to the Minister for Health and Aged Care.
Thank you, and I thank members for the crossbench for their advocacy of these reforms in their broad sense and their contribution today. I do just want to clarify a couple of things. People cannot buy 9 vapes, and if you look at the legislation, you will only be able to buy 1 month's supply, which will, given that they're reusable, will generally be pods. So people cannot go in and buy 9 vapes from a pharmacy. I need to dispel. The member for McKellar said that a couple of times. I hear the disappointment from members of the crossbench, but let me just reiterate what we have done here. We came to this area saying we intended to wipe out recreational vaping, but we intended to allow genuine therapeutic access to vapes that were not just sort of flooding into this country with who knows what in them, and a variety of levels of nicotine. So to be sold, a vape must not be disposable and must comply with standards that have been put in place in March by the TGA around nicotine content and a range of other chemical content. They must have a permit from the Office of Drug Control. So this is a very different situation to the one we faced only a few months ago. Already we have seized more than 2.5 million disposable vapes at the border. We are starting to choke off supply already. And these measures, the third wave of our reforms, if they pass the House today, will see these vape stores that have deliberately opened up down the road from our schools start to shut down. There is no change to our intention to wipe out the retail element of this market and the recreational vaping market in broad terms. There are different views about whether a Schedule 3 medicine is a therapeutic pathway. I disagree with members of the crossbench who imply at the very least that a Schedule 3 pathway is not consistent with our view about this being a therapeutic good. This is not a retail supply. This is not, in contrast to the member for Warringah's description, making pharmacists tobacconists. And using that language, frankly, is quite misleading. There is no suggestion that pharmacists would ever be able to supply tobacco or stock tobacco. Now, as to consultation, the Senate debate I heard, there have been Senate committees here. Everybody, including the pharmacist business lobby, has been able to participate in those inquiries. They've been in the corridors meeting with crossbenchers in the other place. I heard in the debate yesterday that one of the suggestions from that group was that this be a Schedule 2, not a Schedule 3. So it would be available over the counter, take it off the shelf, provide it to the pharmacy assistant or the retail assistant. That is very different to what is before the House right now. This does require a conversation with a qualified health professional. It is a pharmacist. It is the same discussion you would have to access the morning after pill, a range of other serious asthma medicines, pseudoephedrine and a range of things like that. I reject the idea this is some retail model. This is a therapeutic model. It might not be the model the crossbench likes or the model that was in the original bill, but it is still very much a therapeutic model. the Pharmaceutical Society of Australia, the professional body for pharmacists, not the business group, but the professional body of pharmacists, has said, as it should, that if this legislation passes, it will work with the government to update their clinical practice guidelines. Pharmacists have been having these discussions for years with their patients and customers. They provide a whole range of other smoking cessation supports and nicotine replacement therapies, as particularly the doctors on the crossbench understand very, very well. I understand the disappointment. I understand those in this place and outside who would like to see the bill have been retained in its original form, that it would be a doctor or nurse practitioner prescription-only model. This was an alternative pathway that had been discussed openly by health ministers over the last 12 months who were concerned about access issues. The member for Kooyong rightly raised them. There are difficulties getting in to see a GP, not just in rural and regional Australia, but in many cities as well. And so these are fine questions of balance. I accept that reasonable people can disagree who come to this debate with goodwill, but I reject any idea that the amendments before the House now are anything other than consistent with our intention to provide only a therapeutic pathway to these goods.
The question is the amendments be agreed to. And I give the call to the member for Griffith.
Thanks, Speaker. I just wanted to address two issues, and I thank the Minister for his comments. The first is on the criminalisation of possession, and I think this is actually quite a crucial point because what we have seen in the past, especially when it comes to kids, and in my home state of Queensland, where in particular First Nations kids are often over-policed in their communities and possession charges are often used as an excuse to go after them, harass them or discriminate against them. The Greens are very proud of the fact that we've been managed to get rid of criminalisation for possession, or at least make it ensure that those situations where a kid with one or two vapes isn't harassed by the police on basic possession. And that's crucial because prohibition at that scale has never worked. The government cannot even keep drugs out of prisons. So I'm not sure what would be to gain out of increasing the criminalisation or over-policing, often of vulnerable communities, and in particular of marginalised children. And so I think this is a huge, significant gain, because it means right now for the lives of kids who, if they are using vapes, that is a health issue. Surely it's not an issue that should involve the police or the criminal justice system. And pushing kids into a situation where they have to hide the fact that they vape, lest they worry about being criminalised, surely makes it less likely that they might actually get health support in the future. Kids should be treated completely differently in that situation. So I do support that. And the second thing around the shift to the pharmacy model is, again, prohibition. All prohibition has done in the past, even with alcohol in other countries around the world, all it has done is created a black market. It has pushed people to seek out criminals and some of the worst people in the world, the illegal drug trade, to seek out drugs that they are always going to try and seek out. The state has never been able to successfully stamp out any illicit drug. Never. And in this situation, it's a good thing that we've at least ensured that people don't have to think about either paying a huge gap to go and see a GP that they already struggle to get access to a vape, because if with that level of barrier, that will mean more people end up trying to access them illegally. And I think it's a genuinely positive thing, as the minister said, that when they do go to purchase a vape, they do have to have a conversation with their pharmacist, but they don't have to cross another financial barrier and another logistical barrier to get something, let's be frank, that a lot of people are already going to try and get. And so I think this has been the process of a genuinely good negotiation between the government and the Greens and parts of the crossbench that has led to a fine balance, balancing out in this parliament differing views about how we regulate drugs in our society and acknowledging the evidence. Because if anyone can point to me a moment in history, in any country around the world, where prohibition to that level has worked to stamp out the usage of illicit drugs, I'll be happy to look at it. Because what it has often resulted in is the over-policing of marginalised communities, in particular in my home state of Queensland, massive increases in incarceration rates for First Nations children in particular, who, let's be clear, they're kids. They're kids. What on earth is interacting with a police officer who has a go at them for having a couple of vapes going to achieve, other than further marginalising them and further pushing them into a criminal justice system they should not have to interact with? So I think there's a lot of positives in this shift, and I suppose I just wanted to get up and defend them.
The question is the amendments be agreed to, and I give the call to the member for Indi.
Thank you, Mr Speaker, and I thank the member for Griffith for that contribution to the debate. And I agree with him. I do not want to see young people criminalised or being subjected to the criminal justice system. I think one of the problems with what we're asked to consider today is that we have a block of amendments. It's difficult to vote for everything when you have problems with elements of these amendments. So I want to put on the record that I agree with him. I agree with that Greens amendments about ensuring that we do not criminalise people with vapes for personal use, although I still have concerns in regard to the number of 9. I take the minister's point that he made in regard to the number of vapes, and that it's not 9 actual vapes if we talk about the covering material. But again, I just want to say that this is a block of amendments with many implications that take us away from the primary bill that we voted in favour of, and I thank the member for Griffith for his explanation just now.
The question is the amendments be agreed to, and I give the call to the member for Ringa.
Thank you, Mr Speaker. And I'd like to echo the sentiments of the words from the member for Indi I strongly agree. I don't want to see criminalisation of youth. And that is a major problem, especially when it comes to First Nations children and that over-representation in our criminal system and all of that. But I do have concerns with the number of what is considered personal use. And I would like a better explanation from the Minister as to why personal quantity has been considered to be 9, and how does that extrapolate over a period of time? Because even though if you are talking about that it's 1 item with then a refill, is that a situation where a person can have 9 refills on them each day, but there is no essential cap on an amount that a person can have access to over a period of a month or something like that? Because the concern is, if you are allowing someone over 18 to go to a pharmacy, as the member for Mackellar has said, what protections will there be if there is no data being recorded for that situation of going pharmacy shopping? And that does, with respect, result in that comparison that you are going to see pharmacies. There is a become similar to a tobacconist in the sense that they are providing a highly addictive and dangerous item without there being any caps or limits. I don't understand that there is any monthly cap or anything like that as to people being able to access this. And if there is no record being kept, then a person does go from pharmacy to pharmacy to get that supply. So I do have an issue with the concept that personal use is 9 unless a better explanation can be provided as to how does that 9 quantify, how does that reflect over a period of time, are any caps going to be in place, what measures are going to be in place to ensure we don't have pharmacy shopping, jumping from one to the other, and an excessive amount being available to people. This is a highly addictive substance or process. And we know people get addicted to it. We know it's incredibly hard for people to stop smoking. We know it's probably going to be incredibly hard for people to stop vaping. And so what assistance are we generally providing? What measures are we generally putting in place now as a result of these amendments to ensure we are not just leading people down another pathway of addiction?
The question is the amendments be agreed to. Give the call to the honourable member for Mackellar.
Thank you, Speaker. I'd also like to thank the member for Griffith for his contribution to this. I think so many of us here do not want to see the possession of small amounts of vaping material be criminalised. I concur with that fully. I'd just like to also concur with the member for Warringah in what will be the data collection around the purchase of vapes from pharmacies, because really that is required so that it is truly a therapeutic relationship and it's not being misused. So I'd like to hear from the Minister, if possible, about what will be the data collection from pharmacies. Thank you.
The question is the amendments be agreed to. And I give the call to the Minister for Health and Aged Care.
Thank you, Speaker. I thank the members for their further contributions. Look, this question of possession has been a process of discussion and consideration, as members know, particularly when it comes to the pods, because all of these will be reusable vapes. You will not be able to buy disposable vapes anymore. We're conscious that when we set particular regulations about these things, the industry tries to sort of readjust their product to get around them. So these are, again, matters of judgment. And what we have sought to do is to set those offence provisions, or the number of devices, at a level that does not lead to people, users, being potentially targeted or potentially in breach of offence provisions here, to allow a range of different scenarios. I mean, one of the matters that was put to us quite strongly in the Senate debate was that people in rural and regional Australia often will buy additional supplies so they don't have to keep going back every month. So trying to take account of a range of things. Now, this is a new area. I mean, I think one of the really positive things about the Senate amendments is for a legislated review here, because this sort of new regime really is quite different. It's very different to the way in which we've managed tobacco. It's quite world-leading. I don't think any of us pretend to know exactly how it will roll out, and that 3 years down the track we won't say as a parliament that there are not ways in which we would want to tweak a range of things and maybe change it substantially. And I think that's been a constructive part of the amendments coming through from the Senate. As to data collection, again, this is something that was the subject of discussion over in the other place. And as many members of the crossbench will know, particularly the member for Mackellar, as a former, well, still a GP, will know the pseudoephedrine model, or Project STOP, was set up also as a Schedule 3 medicine, so it requires a discussion with a pharmacist. You are not always successful in obtaining pseudoephedrine-containing products when you go and have that discussion with a pharmacist. I can attest to that with personal experience. Earlier this year, being marched out of my local pharmacy on a Sunday morning on the basis that I did not meet all of the conditions for access to cold and flu tablets that contained pseudoephedrine. It was rather humiliating, I must say, as the country's health minister. But I can attest that discussion does work. The data entry requirements of Project STOP for pseudoephedrine were put in place because of law enforcement concerns around what was happening to pseudoephedrine, and it was being cut up into methamphetamine manufacture. And so there was a particular law enforcement imperative or motivation for that measure. We considered that there was not the same here. There is a concern about people going into multiple pharmacies potentially and buying more than one vape in a month, and then potentially on selling them. And balanced against that was for pharmacists generally in Schedule 3 medicines, with only really the exception of pseudoephedrine because of that law enforcement concern, to focus their time on the discussion, the therapeutic discussion, rather than data entry, which would then, to be effective, have to be linked to other pharmacies and have some other monitoring regime, which we were not convinced was really going to be a proper regulation. Now, over time, if that judgment is not proven out, then we'll have the opportunity to continue to talk about that. But I thought I'd give members of the crossbench some explanation about where we landed on that.
The question is the amendments be agreed to, and give the call to the member for Mackellar.
Thank you, Speaker. I just would like to talk to that linking of data information between pharmacies, because if that data is not being collected now, then we're not going to be able to make a decision later whether actually that is occurring or not. The other thing I'd like to say, as you mentioned, being a health professional myself, those conversations take a lot of time, they take a lot of investment. And what I can see happening is the pharmacists having to have a lot of those conversations, sometimes needlessly. If there are people who are going from pharmacy to pharmacy, it does take a lot of time, and people do that. People do go to various doctors and doctor shop, and it takes a lot of time and investment. So I think what we need to know is that that information will be collected up front, so that we can make a decision in a couple of years' time as to whether that is actually occurring. So I would encourage the Minister to look at implementing that use, that linking of pharmacy data now, so that we can actually make a decision in the future. If we don't have that data now, we are simply unable to make that judgment in the future.
I thank the honourable member for McKellar. And the Minister? Do you want to finish up? Okay. We'll put the question, or put the amendments. Would you like to move to I put the question? So I move now. I'll put the question that the amendments be agreed to. All of that opinion say aye. Those against say no. I think the ayes have it. Noes have it. Division required. Ring the bells for 4 minutes. Thank you, mate. Thank you, mate.
Lock the doors. The question before the House is the amendments be agreed to. The ayes will pass to the right of the chair and the noes to the left. Appoint the honourable members for Werriwa and Bean as tellers for the ayes, and the honourable members for Kooyong and Wentworth as tellers for the noes. The result of the division is ayes 67, noes 10. Matter is resolved in the affirmative.